I'm Dr. Brett Martindale, sports medicine physician here at Ogden Clinic. I want to talk about osteoarthritis today. Osteoarthritis is a degenerative condition of the joint whose hallmark is the loss and wear of cartilage within the joint. But it's more than just that. It's wear of the underlying bone, it's wear of the lining of the joint, it's wear of the muscles and tendons even around the joint that all together work to cause a lot of pain in the joint. It can result in loss of function, reduced range of motion, swelling of the joint, and other problems that can inhibit normal everyday activities or the recreational activities that you would like to do. The downside of osteoarthritis of a joint is that there's no cure for it. We can't regrow cartilage, we can't reverse the process of arthritis. But the goal of treatment for arthritis is to reduce pain and improve function. And there are several treatment options that can help reach those goals of reducing pain and improving the function of an arthritic joint. The most basic, and not to be dismissive of any pain or symptoms that you might be having, but the most basic option is to leave it alone, to not do anything. We don't have to do anything. I never want any patient to feel like they're being forced into any certain treatment for an issue. Sometimes these things will calm down over time and settle down. They can certainly always flare back up, but we don't have to do any aggressive intervention at any time. Another treatment option for osteoarthritis is anti-inflammatory medication, whether it's Aleve, ibuprofen, or anything related to this. They can make a bad day not as bad, but they're not going to provide long-term relief of these symptoms, and they're not great long-term options is the downside. Another option is cortisone shots. Cortisone, or corticosteroid, is a really powerful anti-inflammatory medication. Inside the joint, it reduces inflammation. The idea is that it's reducing the inflammation that leads to the pain and dysfunction within the joint. The downside of a cortisone shot is that the duration of activity or the duration of relief may provide is unpredictable. It could be days, weeks, months, years, or anything in between. The most typical is a few months, though again it can be very unpredictable. Cortisone shots are not great to be repeated time and time again for a long period of time. They can be repeated, but if someone is needing a cortisone shot every few months just to get by and they're repeatedly needing these injections over and over again, that's a sign that we need to consider other potential treatment options to hopefully provide more long-lasting relief. Other injections for osteoarthritis include viscosupplementation, which is also known as gel shots. The real ingredient in these gel shots is called high hyaluronic acid, or HA. HA is a normal product that your body produces. It's been inside your joints ever since you've been you. It works by increasing the lubrication in the joint, making it a lower friction environment for the bones to slide past each other, but also to provide cushioning within the joint. It also plays important roles in reducing inflammation in the joint and helping to preserve the cartilage. But over time, as we age and as we develop arthritis, the HA that our body produces gets smaller and smaller and thus less effective at its job. And so at some point, someone had the bright idea of what would happen if we injected more of this HA into an arthritic joint. Could it help? And the answer is yes. It can potentially help with the pain from arthritis in a different way than cortisone shots. Another injection yet for osteoarthritis is called PRP, or platelet-rich plasma. Platelet-rich plasma is your own blood. We draw some blood out, we separate it in a centrifuge, we separate the platelet portion from the rest of your blood, and we take those platelets that are now really concentrated and isolated, and we inject it back into your joint. The idea behind this is that platelets are very rich in growth factors. Growth factors are the signals in your body that stimulate healing. Now, PRP has never been shown to regrow cartilage or reverse arthritis. It doesn't make your joint brand new again, but it can deviate your joint away from those degrading processes that break down the cartilage, that inflame the lining of the joint, in favor of a process that is more restorative to the cartilage, that reduces inflammation in the joint and can provide longer-term pain relief. Another treatment option regarding osteoarthritis is bracing, or stabilizing the joint. Braces can be somewhat hit or miss depending on the degree of arthritis and exactly where the arthritis is located, but sometimes it can provide some stability for the function of that joint. Other times, braces can just get in the way. It's kind of a trial and error thing when it comes to braces with arthritis, but certainly a non-invasive treatment option that can provide significant relief to some people. Another treatment option is physical therapy or exercises, whether it's done on your own or whether it's working with a physical therapist. Even though physical therapy can't change the amount of cartilage in your joint or reverse the effects of arthritis, keeping the muscles around a joint strong and functioning correctly reduces the stress that goes across that joint, and that aggravates the pain within that cartilage and within that joint. And so even though it can't fix the problem, physical therapy has long been shown to be able to help with pain and dysfunction from arthritis. The ultimate treatment option for many types of arthritis is surgery. Sometimes it's just cleaning things up, and sometimes it's replacing the entire joint. Again, the whole idea of treatment for arthritis is to reduce pain and improve function, whether it's with oral medications, shots, therapy, braces, and it's no different with surgery. The difference with surgery is that once it's done, it can't be undone, which is why I recommend trying other non-invasive things first to see if they can provide that level of comfort and function that you're looking for. If it simply doesn't happen, if these conservative treatments don't provide pain relief, they don't provide restoration of your function, that's when it's time to look more into surgical intervention for arthritis. Another option for osteoarthritis is not necessarily a treatment, but a way to further evaluate the arthritis, and that's an MRI. X-rays often give us an idea of the presence of arthritis, but don't always accurately tell us the degree to which the arthritis is affecting the joint, or if there could be other things complicating the arthritis within the joint. And that's where an MRI can come into play. So an MRI is often another option that we have to further evaluate the degree of arthritis or any other complicating issues. Finally, if you've had any thoughts, I'll be in the room shortly and we can discuss those things so that we can get your questions and concerns addressed.